This is the video on tardive dyskinesia. Tardive dyskinesia, or TD, is a neurological syndrome that presents with involuntary and repetitive body movements. One such symptom is tongue thrusting. The person sticks their tongue out multiple times a minute, often several times in a row. Another symptom is facial grimacing. The person will grimace every few seconds throughout the day. They are also seen smacking their lips, pursing their lips, frowning, and blinking their eyes excessively. Some people will have writhing movements of the body or jerking movements of the extremities. These movements interfere with normal life activities. TD is often seen in people over the age of 50 and is more common in females. TD is not common overall, though, as there are less than 200,000 cases a year in the US. One of the most common causes of TD is medication side effects, especially for antipsychotic drugs. The long-term use of drugs that block dopamine receptors, for at least months if not years, can result in TD. This is a real problem for people on these antipsychotic medications, as once the TD starts, it can be a permanent condition, even if the medication is stopped. Up to 30% of people can develop TD from their medications. The mechanism of how these medications cause TD is unknown. There are variants to TD. One is tardive dystonia. Here the person presents with dystonic movements or the unintentional sustained muscle contractions that lead to abnormal postures that are sometimes held for hours. It will interfere with walking and all voluntary movement. Tardive dystonia tends to be a permanent condition once it starts, as there is no treatment for it. Another variant is tardive akathisia. Here the person has painful feelings of inner tension, anxiety, and a compulsion to move the body. This can become so extreme that the person literally cannot sit still and is in constant motion. TD was first noted in patients taking the antipsychotic chlorpromazine when it was introduced in the 1950s. It is thought that some people have a hypersensitivity to dopamine in the medication, particularly in the nigrostriatal pathway. The greater the D2 binding affinity of the medication, the greater the risk of developing TD after being on the drug. This is known as the D2 hypersensitivity hypothesis. The higher the dose of the medication, and the longer the treatment with the medication, the higher the risk of the development of TD in the person. If the person is older, has a history of drug abuse or alcoholism, or has had traumatic brain injuries in the past, there is a higher risk of TD. Sometimes, the person does not even develop TD until they stop taking the medication. TD is a real complication from the antipsychotic medication, and the risks and benefits of starting these medications must be weighed seriously. The person on these medications must be monitored closely, and if TD develops, they must be taken off the medication. Treatments for TD is spotty and unreliable, often leading to the movement disorder becoming permanent. This ends the video on tardive dyskinesia.